Worried about what those high creatinine numbers on your latest blood test really mean? You're not alone, and it's not always a direct sign of kidney failure. We're about to uncover some surprising reasons your levels might be up. You see, many older adults discover elevated creatinine levels during routine checkups, and this often sparks concern about their kidney function. Now, while kidney disease is certainly a well-known culprit, there are actually several lesser-known factors that can contribute to these rising creatinine levels in seniors. And understanding these hidden causes is really crucial for timely intervention and ultimately for better health outcomes. Number 1, medication side effects. So, let's dive into our list. First up, at number 1, we have medication side effects. It turns out that one of the most significant, yet often overlooked, causes of increased creatinine levels in older adults is actually the side effects of commonly prescribed medications. You know, as we age, our bodies process drugs differently. And the kidneys, which play such a crucial role in filtering out medication byproducts, can become more susceptible to their effects. It's quite common for many seniors to manage multiple health conditions, and this often leads to a regimen of several medications, a situation sometimes called polypharmacy, which in turn further elevates the risk of drug-induced kidney issues. Now, when we look at common prescriptions, there are quite a few that can inadvertently lead to a rise in creatinine. For example, non-steroidal anti-inflammatory drugs, or NSAIDs, which are frequently used for arthritis and pain relief, can actually reduce blood flow to the kidneys. This impairs their function and causes creatinine to accumulate. Then there are certain antibiotics, including some aminoglycosides and vancomycin. These can be directly toxic to kidney tubules if they're not dosed carefully, especially in older individuals whose kidney function might already be subtly declining. And what about diuretics, often called water pills? They're prescribed for conditions like high blood pressure or heart failure, but they can sometimes lead to dehydration or affect kidney hemodynamics, indirectly raising creatinine. Furthermore, some cardiovascular drugs, such as ACE inhibitors and ARBs, while generally protective of the kidneys in the long term, can cause an initial, often temporary increase in creatinine. This might happen when they're first started, or if dosages are adjusted, particularly if dehydration is also present. So, how exactly do these drugs impact kidney function and creatinine clearance? Well, the mechanism varies. Some medications can cause a direct toxic effect on the kidney cells themselves. Others might constrict the blood vessels that supply the kidneys, which reduces their filtration capacity. And still others can lead to the formation of crystals in the kidney tubules. This obstructs urine flow and leads to a buildup of waste products like creatinine. This is precisely why understanding how specific medications interact with kidney physiology is so essential. For instance, if a drug reduces what's called the glomerular filtration rate, or GFR, that's the speed at which kidneys filter blood, it will naturally lead to less creatinine being cleared from the bloodstream, and that results in higher serum levels. Given all these potential risks, the importance of regular medication review and diligent monitoring in seniors really cannot be overstated. It's absolutely vital for older adults and their caregivers to maintain an open dialogue with healthcare providers about all medications being taken. And this includes over-the-counter drugs and supplements, too. Physicians really should periodically assess the necessity of each medication. They should explore alternatives if kidney-harming drugs are involved and adjust dosages based on current kidney function. Plus, regular blood tests to monitor creatinine levels and GFR can help detect any adverse effects early on. This allows for prompt intervention to prevent more serious kidney damage. Ultimately, this proactive approach ensures that medications provide their intended benefits without unduly compromising kidney health. Number 2, dehydration and fluid imbalances. Moving on to number 2 on our list, dehydration and fluid imbalances. It might surprise you, but dehydration is a remarkably common and frequently underestimated factor that can cause a significant, though often temporary, increase in creatinine levels. This is particularly true for the older population. You see, as we age, several physiological changes occur that actually make seniors more vulnerable to dehydration. For one thing, the natural thirst response, that little signal that tells us to drink when our bodies are low on fluids, tends to diminish with age. What this means is that older adults might not even feel thirsty when their bodies desperately require more water. And compounding this issue is an age-related decline in the kidney's ability to concentrate urine efficiently. Younger kidneys are quite adept at conserving water when fluid intake is low, producing more concentrated urine. However, in older adults, this concentrating ability often wanes. This leads to greater water loss through urine, even when their intake is insufficient. On top of that, chronic illnesses and certain medications, like those diuretics we mentioned earlier, can further exacerbate fluid loss. As a result, maintaining an adequate fluid balance becomes a much more delicate act for seniors. It's important to know that even mild dehydration can cause creatinine levels to spike. Here's how it works. When the body is low on fluids, blood volume decreases. This reduced volume means less blood flows through the kidneys per minute, which then leads to a decrease in the glomerular filtration rate, or GFR. With a lower GFR, the kidneys simply filter out less creatinine from the blood, causing its concentration in the bloodstream to rise. So, essentially, the creatinine isn't necessarily being produced at a higher rate, it's just being cleared less effectively due to that reduced kidney perfusion. This type of creatinine elevation is often referred to as pre-renal because the issue lies with blood flow to the kidneys rather than damage to the kidneys themselves. The good news is that rehydrating adequately usually restores normal kidney function and brings those creatinine levels back down. However, it's not quite as simple as just drinking more water. While addressing dehydration is absolutely crucial, there's also a risk associated with overcorrection. This is especially true for older adults who may have underlying heart conditions, like heart failure. If large volumes of fluids are administered too rapidly, particularly intravenous fluids, it can overwhelm a compromised cardiovascular system. This could potentially lead to fluid overload, worsen heart failure symptoms, or even cause pulmonary edema, which is fluid in the lungs. Therefore, rehydration in seniors, especially those with other health conditions, must be managed very carefully. This often means gradual fluid replacement and close monitoring by healthcare professionals. The goal, of course, is to restore optimal hydration without placing undue strain on other body systems, making sure that the solution to one problem doesn't inadvertently create another. Number 3, high-protein diets and supplements. Coming in at number 3, let's talk about high-protein diets and supplements. It's interesting because the dietary choices of older adults, particularly when it comes to protein intake and the use of certain supplements, can also play a direct role in elevating serum creatinine levels. Now, don't get me wrong, adequate protein is absolutely essential for maintaining muscle mass and overall health in seniors. But an excessive intake, especially from certain sources, can lead to higher creatinine readings that might not necessarily reflect actual kidney damage. You'll find that many older adults are increasingly aware of the importance of protein for combating age-related muscle loss, which is known as sarcopenia. Because of this, they might consciously increase their consumption of protein-rich foods or turn to protein supplements. This could mean eating larger quantities of meat, poultry, and fish, or incorporating protein powders and shakes into their daily routine. Additionally, creatine supplements, which are quite popular among athletes for muscle building and performance enhancement, are sometimes used by older individuals who are hoping to preserve their strength and vitality. It's important to remember that creatine is a compound that is naturally converted in the body to creatinine. So, if you're supplementing with creatine, you're directly increasing the amount of creatinine that needs to be filtered by the kidneys. So, how do dietary changes, specifically those that lead to a significant and sustained increase in protein intake, particularly from cooked meats, influence creatinine levels? Well, when protein is metabolized by the body, one of the byproducts is creatinine. And cooked meat itself actually contains creatinine. So, consuming large portions means you're ingesting more preformed creatinine, which is then absorbed into the bloodstream. Even if kidney function is perfectly normal, a higher load of protein breakdown products and ingested creatinine will naturally result in a higher level of creatinine circulating in the blood, and that's what gets measured in a blood test. Let's dig a little deeper into why protein breakdown leads directly to higher serum creatinine. It's really rooted in muscle metabolism and dietary intake. Creatine is synthesized primarily in the liver and kidneys. From there, it's transported to muscles, where it's converted into phosphocreatine, which is an energy reserve. Both creatine and phosphocreatine are spontaneously converted into creatinine at a relatively constant rate. This happens non-enzymatically. This creatinine is then released from the muscles into the bloodstream. So, a diet that's very high in protein, especially animal protein, provides more amino acids. These are the building blocks for creatine synthesis. And as we just mentioned, cooked meats directly contribute creatinine. Therefore, even if the kidneys are functioning efficiently, the sheer volume of creatinine they need to filter increases, and this leads to a higher baseline level in the blood. This is why healthcare providers often take recent dietary habits into account when they're interpreting creatinine results in older adults. Number 4, muscle mass decline and catabolic states. All right, let's look at number 4, muscle mass decline and catabolic states. This one's quite interesting because the relationship between muscle mass and creatinine levels can present a somewhat paradoxical situation in older adults. As you may know, creatinine is a waste product that comes from the normal breakdown of creatine phosphate in our muscle tissue. Because of this, an individual's baseline creatinine level is generally proportional to their overall muscle mass. So, typically, more muscle means slightly higher, but still normal, creatinine. However, certain conditions related to muscle changes in seniors can actually lead to fluctuations or even elevations in creatinine that require very careful interpretation. Now, age-related muscle loss, a condition also known as sarcopenia, is a pretty common phenomenon. As individuals age, they naturally tend to lose some muscle mass and strength. So, you might logically assume that less muscle mass would lead to lower creatinine production and therefore lower serum creatinine levels. And while this is often true for baseline levels in frail older adults, who, it's worth noting, may have deceptively normal or low creatinine despite reduced kidney function, acute situations involving rapid muscle breakdown tell a completely different story. We're talking about catabolic states. These are conditions where the body breaks down its own tissues, including muscle, at an accelerated rate. And these states can cause a surge in creatinine release. Such states can be triggered by things like severe infections, major surgery, trauma, prolonged bed rest, or even uncontrolled chronic diseases. So, what happens during these acute illnesses or periods of intense physiological stress? Well, the body enters a catabolic phase to meet increased energy demands, and this leads to accelerated muscle protein degradation. This sudden and significant breakdown of muscle tissue then releases a larger than usual amount of creatinine into the bloodstream. Now, even if the kidneys are functioning normally, they might be temporarily overwhelmed by this increased load. The result? A noticeable rise in serum creatinine levels. It's important to understand that this elevation is a direct consequence of increased creatinine production from muscle catabolism, rather than a primary decline in kidney filtration capacity, although it's true that severe illness can sometimes also concurrently impair kidney function. This brings us to what can be described as the paradox of lower muscle mass, but potentially fluctuating or acutely elevated creatinine. Let me explain. An older adult with sarcopenia might have a low baseline creatinine. However, if they experience an acute illness that triggers muscle catabolism, their creatinine can rise sharply. This isn't because their muscle mass suddenly increased, but because the existing, albeit reduced, muscle is breaking down rapidly. This really highlights the importance of context when interpreting creatinine levels in seniors. For example, a stable, low creatinine in a frail individual might still mask underlying kidney issues. On the other hand, a sudden spike might indicate an acute catabolic process rather than a chronic decline in kidney health. And these two scenarios would require different diagnostic and management approaches. Number 5, undiagnosed chronic conditions. And finally, at number 5, we have undiagnosed chronic conditions. So, beyond medications, dehydration, diet, and muscle changes, another significant hidden cause of rising creatinine in older adults can be the silent progression of undiagnosed or poorly managed chronic health conditions. The thing is, many systemic diseases can gradually impair kidney function over time, often without causing any obvious symptoms until significant damage has already occurred. In these cases, elevated creatinine may actually be one of the very first indicators that such an underlying condition is taking its toll on the kidneys. There are several chronic conditions quite common in seniors that are notorious for their potential to affect kidney health. For instance, undiagnosed or inadequately controlled type 2 diabetes is a leading cause of chronic kidney disease. When blood sugar levels are persistently high, they can damage the small blood vessels in the kidneys, which impairs their ability to filter waste products effectively. Similarly, long-standing hypertension or high blood pressure can strain and damage these delicate blood vessels, leading to a gradual decline in kidney function that then manifests as rising creatinine. Autoimmune diseases such as lupus can also involve the kidneys, causing inflammation and damage, a condition known as lupus nephritis. And in men, prostate disorders like benign prostatic hyperplasia or BPH, which can cause urinary obstruction, can lead to back pressure on the kidneys. If not addressed, this can potentially impair their function over time. The really insidious nature of chronic kidney damage associated with these conditions means it often escapes early detection. You see, the kidneys have a remarkable reserve capacity. Significant damage can occur well before symptoms like fatigue, swelling, or changes in urination become noticeable. Creatinine levels might rise very, very slowly over months or even years, and these subtle increases can be easily missed if they're not trended carefully over time or if baseline levels weren't known. Sadly, by the time creatinine is noticeably elevated, a considerable degree of kidney function may have already been lost. This is precisely why routine screening for conditions like diabetes and hypertension, along with regular monitoring of kidney function in those who are diagnosed, is so incredibly vital. This is where the importance of a comprehensive geriatric assessment really becomes evident. Such an assessment goes far beyond just looking at isolated lab values. It considers the older adult's overall health status, including all existing medical conditions, medications, their functional ability, and their nutritional state. This kind of holistic approach helps healthcare providers connect the dots between seemingly unrelated issues and identify potential underlying causes of rising creatinine. For example, discovering poorly controlled blood sugar in an individual with newly elevated creatinine could strongly point towards diabetic nephropathy. So, early identification and management of these underlying chronic conditions are absolutely paramount to slowing the progression of kidney damage and preserving long-term kidney health. Recognizing the signs, when to seek help. Now that we've covered those 5 hidden causes, let's talk about recognizing the signs, when to seek help. It's important to know that while elevated creatinine itself doesn't always cause specific symptoms, especially if the rise is mild or recent, it can certainly be a marker of underlying kidney issues or other health problems that do show symptoms. So, seniors and their caregivers should really be aware of certain signs that might accompany high creatinine or indicate declining kidney function. What should you look out for? Well, these include persistent fatigue, swelling in the legs, ankles, or feet, which is called edema, a decreased urine output, or, on the flip side, frequent urination, especially at night, that's nocturia. Other signs can be shortness of breath, nausea, vomiting, or a loss of appetite. It is absolutely crucial to seek medical attention if any of these symptoms appear. This is particularly important if there's a known history of kidney issues or risk factors like diabetes or hypertension. And even if there are no obvious symptoms, if routine blood work reveals a new or worsening elevation in creatinine levels, a consultation with a healthcare provider is definitely warranted. Getting that early discussion and investigation can really help determine the cause and allow for appropriate management to be initiated before more significant kidney damage occurs. Testing, diagnosis, and monitoring in older adults. So, what happens when high creatinine is found? Let's discuss testing, diagnosis, and monitoring in older adults. When elevated creatinine is detected in an older adult, doctors will typically undertake a very careful evaluation process. This usually involves reviewing the individual's medical history, their current medications, and any existing health conditions. Then, further tests may be needed. These can include a urinalysis, which checks for protein or blood in the urine. Kidney imaging, like an ultrasound, might be done to assess the structure of the kidneys. And of course, repeated blood tests are often used to track creatinine trends and to calculate what's called the estimated glomerular filtration rate, or eGFR. The eGFR is actually a more accurate measure of kidney function. Now, interpreting creatinine levels in the elderly requires a bit of nuance. That's because normal thresholds can be influenced by several factors. Age itself is a consideration, as kidney function can naturally decline modestly with age. Muscle mass, which, as we've discussed, tends to decrease in later life, also affects creatinine production. This means a lower muscle mass might result in a lower creatinine level, potentially masking underlying kidney disease if only the absolute values are considered. Historically, sex and, in some contexts, race-based adjustments have been used in eGFR calculations, though it's worth noting that the use of race-based adjustments is currently undergoing re-evaluation to ensure equitable care. What's often most informative, though, is looking at trending values over time, rather than relying on a single reading. Prevention and management strategies. This naturally leads us to think about prevention and management strategies. Protecting kidney health as we get older really involves a multifaceted approach. It's centered on proactive lifestyle choices and diligent medical care. One of the simplest, yet most effective steps is maintaining adequate hydration. This means drinking enough fluids throughout the day, unless, of course, you're medically advised otherwise due to specific conditions like heart failure. Another crucial step is the regular review of all medications, and this absolutely includes over-the-counter drugs and supplements. Discussing these with a doctor or pharmacist is key to identifying and mitigating any potential harm to the kidneys. Of course, a balanced diet, which is appropriate for any coexisting conditions like diabetes or hypertension, plays a really significant role. This often means moderating protein intake if your doctor advises it and focusing on whole foods. And finally, regular medical checkups that include screening for kidney disease are paramount. This is especially true for those with risk factors. You see, early detection and management of conditions like high blood pressure and diabetes can significantly slow any potential decline in kidney function. And that, in turn, helps seniors maintain their kidney health and overall well-being for a much longer time. So, to wrap things up, rising creatinine in older adults isn't always a straightforward indicator of a severe kidney problem. As we've discussed, it can often be the result of hidden and, importantly, modifiable factors. By understanding and proactively addressing these lesser-known causes, seniors can work closely with their healthcare providers. And by doing so, they can maintain better kidney function and safeguard their overall health for many years to come. If you found this guide helpful, we'd really appreciate it if you would share it with friends or family who might benefit from this information. We also invite you to join the discussion in the comments below. Feel free to share your questions or experiences. And please, don't forget to subscribe for more in-depth health articles focused on senior wellness and vital medical insights.